A cardiac profile test is a series of blood tests used to assess cardiovascular disease risk and to diagnose active heart diseases, including myocardial injury, ischemia, and heart failures. Because heart diseases are often caused by inflamed cholesterol plaques blocking blood vessels, a routine cardiovascular risk assessment typically includes a lipid panel and assays of systemic inflammatory biomarkers. A lipid panel measures total cholesterol, low-density lipoprotein, LDL, high-density lipoprotein, HDL, and triglycerides. A healthy profile is when HDL is high and all others are low. A non-HDL cholesterol value can be calculated as total cholesterol minus HDL and represents a better marker of risk than individual cholesterol measurements. When genetic influence is suspected, another lipid component called lipoprotein A, LPA, is also measured. LPA is basically LDL bound to a protein called apolipoprotein A. Higher LPA levels correlate with higher genetic predisposition to cardiovascular events. The most used biomarker for systemic inflammation is C-reactive protein, CRP. CRP is produced by the liver in response to inflammatory chemicals. Because CRP also rises in acute illness, it must be measured twice, a couple weeks apart, to rule this out. Cardiac troponin is the gold standard assay when myocardial injury is suspected. Troponin is a component of cardiac and skeletal muscle and is released into the bloodstream upon tissue injury. Cardiac troponin subunits I and T are different from their counterparts in skeletal muscle, making them specific markers for myocardial injury. Troponin levels in the blood rise a couple hours after symptom onset, peak in 24 to 48 hours, and remain elevated for many days. This makes troponins useful for diagnosis of the initial infarction, but not for detecting reinfarctions that may occur during this period. Myocardial injury is highly unlikely if troponins are not elevated. The newer high-sensitivity troponin assay allows earlier diagnosis, and in many cases by a single blood test. It is most effective in ruling out cardiac injury in patients presenting after more than 2 hours from symptom onset. It can, however, result in more false positives than the standard troponin assay. Creatine Kinase-MB, CK-MB, is another protein released into the blood following a heart attack. CK-MB is an isoform of creatine kinase, an enzyme involved in energy metabolism. CK-MB is more abundant in cardiac muscle, so it has some specificity for myocardial injury, but it can also become elevated in other conditions. Nowadays, CK-MB test is largely replaced by cardiac troponin, but it still has some diagnostic value in detecting reinfarctions or when troponin assays are not available. Myoglobin is a heme protein found in cardiac and skeletal muscle. Being a small molecule, it can be detected in the blood as early as 1 hour after symptom onset. As a result, myoglobin is an early and sensitive but not specific indicator of cardiac damage. This test is most useful in ruling out myocardial injury. Heart-type fatty acid binding protein, H-FABP, is a protein involved in fatty acid metabolism in cardiac muscle. It's an early and sensitive marker of myocardial ischemia, but not specific enough to be used as a standalone test. B-type natriuretic peptide, BNP, is a neurohormone produced by cardiac ventricles in response to ventricular stretch, a hallmark of heart failure. BNP is a body's natural compensatory response. It helps reduce the strain on the failing heart by several mechanisms. BNP levels in the blood increase with the severity of heart failure. The BNP prohormone is cleaved into active BNP and inactive N-terminal fragment, NT-proBNP, both of which can be measured. Despite the fact that BNP levels vary by age, gender, weight, and increase with many other cardiopulmonary disorders, BNP and NT-proBNP assays are still highly specific for heart failure.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike. So do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.